Hello and welcome to our channel. Today, we're going to talk about a very common yet often overlooked issue, especially among our loved ones who are over 70, dry eyes. Many people dismiss this condition as a minor inconvenience, but the discomfort, blurred vision, and potential long-term damage it can cause are significant. In this video, we'll dive deep into the 5 most common reasons why seniors over 70 experience dry eyes. We'll explore the science behind it, provide real-world examples, and give you practical advice. We're not just talking about temporary solutions. We're providing a comprehensive understanding of this condition to help you or your loved ones find lasting relief. By the end of this video, you will have a clear understanding of what's happening, why it's happening, and what you can do about it. So grab a cup of tea, get comfortable, and let's get started on understanding and managing dry eye syndrome in seniors. Before we get into the 5 specific causes, let's briefly understand what a healthy eye needs to stay lubricated. Our tears aren't just water. They're a complex 3-layered film called the tear film. The mucus layer. This inner layer, produced by goblet cells, helps spread the tear film evenly across the eye's surface, like a primer for a wall. The aqueous layer. This is the watery middle layer made by our lacrimal glands. It provides moisture, nourishes the eye, and washes away debris. This is the bulk of our tears. The oily or lipid layer, the outermost layer, produced by the meibomian glands along our eyelids. This layer is crucial because it acts like a shield, preventing the watery layer from evaporating too quickly. When any of these layers are compromised, we experience dry eyes. Now, let's explore why this delicate balance often goes awry in people over 70. Cause 1. Natural age-related decline, the glandular theory. This is the most fundamental reason. Think of our tear glands like any other part of our body. With age, their function naturally declines. As we age, there's a documented decrease in the output of the lacrimal glands, which produce the watery layer of our tears. A study published in the Journal of Ophthalmology found a significant correlation between age and reduced tear production. Researchers used a test called the Schirmer's test to measure tear volume and observed that individuals over 70 had an average tear production of only 40 to 50% of what a young adult would produce. Furthermore, the meibomian glands, responsible for the oily layer, also undergo changes. They can become blocked or atrophy, a condition known as meibomian gland dysfunction, or MGD. This dysfunction leads to a poor quality tear film that evaporates rapidly, leaving the eye exposed and dry. This isn't a disease, it's a natural physiological change that affects nearly everyone to some degree. Imagine a car engine. When it's new, the oil pump works flawlessly, keeping all the moving parts lubricated. Over decades of use, that pump might become less efficient, and the oil it produces might be of a different consistency. Similarly, our tear glands, after 70 years of constant work, just aren't as robust as they once were. This is why many seniors first notice the dry, gritty feeling. It's the first sign that their body's natural lubrication system is slowing down. Cause 2. Hormonal changes in seniors, the endocrine factor. Hormones, particularly estrogen and androgens, play a vital role in maintaining the health of our tear glands. The dramatic shifts in hormone levels that come with age can directly impact tear production. This is especially prevalent in postmenopausal women, but it affects men as well. Estrogen has been shown to have a protective effect on the meibomian glands and the surface of the eye. As estrogen levels plummet after menopause, the glands can become inflamed and dysfunctional, leading to evaporative dry eye. A landmark study from the Women's Health Study provided strong evidence of this link, showing that women on hormone replacement therapy had a lower incidence of dry eye symptoms compared to those not on the therapy. Similarly, androgens like testosterone are essential for the health of both the lacrimal and meibomian glands. As men age, their testosterone levels gradually decrease. This reduction can lead to a similar decline in tear film stability and gland function, contributing to dry eye symptoms. Think of a garden. Hormones are like the fertile soil and sunshine that keep the plants, our tear glands, healthy and productive. When the soil, hormone levels, become less rich with age, the plants may not flourish as they once did, leading to a less vibrant, less healthy environment for the eye. Cause 3. Systemic medical conditions, the comorbidity connection. Dry eyes are often not an isolated issue, but a symptom of a larger systemic health problem. For seniors, who often manage multiple chronic conditions, this is a particularly important factor. Conditions like diabetes and rheumatoid arthritis are frequently linked to dry eye syndrome. Diabetes can lead to a condition called diabetic neuropathy, which damages the nerves that stimulate tear production. The nerves of the cornea can also be affected, leading to a loss of sensation and a reduced blink reflex, which further exacerbates dryness. Sjogren's syndrome, an autoimmune disease, is a classic example. It specifically attacks the glands that produce tears and saliva, leading to severe dry eyes and dry mouth. Studies have shown that up to 90% of individuals with Sjogren's syndrome are women, and the average age of diagnosis is in the late 40s, meaning many seniors over 70 are living with this condition. Other autoimmune diseases like lupus and thyroid disease can also contribute. If you or a loved one is over 70 and suddenly experiencing severe dry eye symptoms, it's crucial to discuss this with your doctor. It may not just be a sign of aging, but a red flag for an underlying medical condition that needs attention. Cause 4. Medications, the pharmacological factor. Seniors often take multiple medications to manage chronic health issues. A surprising number of these common drugs have dry eyes listed as a known side effect. This is a critical, often overlooked cause. Many medications interfere with the body's natural tear production or increase tear evaporation. A review published in the journal Clinical and Experimental Optometry identified several classes of drugs that are commonly associated with dry eyes. Antihistamines, used for allergies. They dry out mucous membranes throughout the body, including the eyes. Decongestants, used for colds and sinuses. Similar to antihistamines, they reduce moisture. Antidepressants and anti-anxiety medications. These drugs, particularly tricyclics, can have anticholinergic effects, which inhibit tear production. Diuretics, used for high blood pressure. They reduce fluid in the body, which can decrease tear volume. Beta blockers, also used for high blood pressure. They can reduce the body's overall secretions. The cumulative effect of taking multiple medications can be significant. The combination of an antihistamine for allergies and a diuretic for blood pressure can create a sort of perfect storm for dry eyes. Never stop taking a prescribed medication without consulting your doctor, but do discuss the possibility of side effects and explore alternative options. Cause 5. Environmental and lifestyle factors, the external triggers. While the other causes are internal, external factors play a huge role. For seniors who may be spending more time indoors or have different routines, these factors can become more pronounced. The environment can be a major trigger for evaporative dry eye. Studies have shown that low humidity and exposure to air conditioning or heating can significantly increase tear evaporation rates. A study in an office environment demonstrated that a few hours in a low-humidity, air-conditioned room could reduce tear stability by up to 50%. Additionally, activities like reading or watching TV for extended periods, which are common pastimes for seniors, can dramatically reduce the blink rate. The average person blinks about 15 to 20 times per minute, but this rate can drop to just 5 to 7 times per minute when concentrating on a screen or a book. Each blink is essential for replenishing the tear film.
Fewer blinks mean the tear film breaks down faster, leaving the eye dry and irritated. Humidify. Use a humidifier in your home, especially during dry seasons. Limit exposure. Sit away from direct drafts from fans, air conditioners, or heaters. Take breaks. Practice the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds. This helps reset your blink reflex.
We've covered a lot today. Dry eyes in seniors over 70 are not a simple issue. They are a complex interplay of natural aging, hormonal changes, underlying health conditions, medications, and environmental factors. Natural age-related decline. The body's lubrication system is simply less efficient. Hormonal changes, declining estrogen and androgens disrupt tear gland function. Systemic medical conditions. Issues like diabetes and autoimmune diseases can be the root cause. Medications. Many common drugs have dry eyes as a side effect. Environmental and lifestyle factors. Low humidity and reduced blinking from screen time are major triggers. The most important takeaway is that dry eyes are treatable. If you or a loved one is experiencing these symptoms, don't just live with the discomfort. Talk to your doctor or an ophthalmologist. There are many effective treatments, from artificial tears and prescription eye drops to procedures that can address underlying gland dysfunction. Taking care of your eyes is a crucial part of maintaining your quality of life. Thank you for joining us today. We hope this information empowers you to take a proactive role in your eye health. If you found this video helpful, please give us a thumbs up and subscribe for more health tips.